want to place a couple of things on the record. First of all, I want to very clearly state the Australian Greens' support for the underlying legislation. This is a good reform that we would have actually liked to see the government pass this legislation earlier in the year. There were many opportunities for this bill to be resolved and passed earlier in the parliamentary agenda. There was a guillotine in March that they could have added it to. There was a guillotine at the beginning of the week they could have added it to. And I know it's caused a bit of stress and strain for the profession, waiting to see the resolution of this legislation. As I said, we support this reform, and so we will not be insisting on the amendment that passed the Senate but has been rejected by Labor in the House, in order to see this legislation pass and for the profession to have certainty. I will also say this. I read the government's reasoning for rejecting this amendment last night. A very simple amendment. An amendment which would have ensured, had the government supported it, that Australians that seek the healthcare support of endorsed podiatrists were able to claim, were able to fill their scripts and receive scripts from their podiatrists that were claimable and usable under the pharmaceutical benefit scheme. It's a very sensible amendment. It closes one of the ridiculous gaps and loopholes in our healthcare system, because as others have contributed and stated really clearly in this debate, right now Australians, a lot of older Australians, a lot of disabled people who seek the expertise of an endorsed podiatrist, a podiatric surgeon, are in the position where those professionals who are enabled by state and territory law to prescribe then face additional costs because they cannot utilise the PBS in filling that script. They have to go back to the GP, where they then face the very real prospect of having to pay a gap fee before then getting a script that would then allow them to get the medication that they need more affordably. That doesn't make sense. It creates additional cost for the person seeking healthcare. It creates unnecessary larger wait times for healthcare services. And the reasoning given by the government to reject this amendment in the House was, quite frankly, and I say this with as much kind of genuine acknowledgement of the diligence with which the Minister and his team has worked across many areas of the health care system and the reform agenda, which we've been supportive of and are supportive of. The reasoning was ridiculous, folks. Like, you've rejected this amendment based on the idea that it's too hasty and doesn't take account of the required consultation needed to enact such a reform. You've had the scope of practice review for 2 years, and this issue has been raised with this government for so long that, if my memory serves right, it was being raised with you when you were last in government in the Rudd-Gillard-Rudd years. This has not come out of nowhere. And this is not extending to a profession that can't already prescribe, the ability to prescribe, because they already can. The patients of those healthcare professionals can't access affordable medicines. We've heard really clearly basic examples. Somebody goes to an endorsed podiatrist with an issue. They are prescribed a regular 12-week course of treatment cream for the condition that might have led them to the podiatrist in the first place. And because of this gap in the law, they pay upwards of $27, $28 more than they need to. And that's without factoring in the additional cost of going back to the GP, the travel time, the complexity. That's ridiculous. We could have closed this loophole and made this form of healthcare more affordable to Australians right now. Right now we could have done that in this vote, but the government has said no. Well, let me say this. We are not going to let this one go. This is a common sense reform whose time has well and truly come. So we're going to keep pushing this, and my message to the Minister and their team is really crystal clear. This is going to keep coming back up. So let's get this done. Let's just come together around something that makes total sense and give people access to more affordable podiatric surgery and more affordable treatment from their endorsed podiatrist. It just makes sense.
Jordon Steele-John just cut through the Canberra nonsense like a knife through butter. He backs the main bill for better nurse prescribing. Fair enough, it's a solid reform that's been kicking around too long. But he rips into Labor for knocking back a simple fix that would have let endorsed podiatrists write scripts patients can actually fill cheaply under the PBS. Listen to this. Older Aussies, disabled folks, and people in the regions go to a qualified podiatrist who can legally prescribe under state law. But because of this stupid federal loophole, they cop full price at the chemist or drag themselves back to a GP, pay a gap fee, waste time, and rack up extra costs. Steele-John nailed one example, a basic 12-week cream costing patients $2,700 more than it should. That's not healthcare. That's bureaucratic madness. The Green senator called Labor's excuse ridiculous. They've had years, scope of practice reviews, consultations going back to the Rudd-Gillard days, yet they still say it's too hasty. Meanwhile, taxpayers and patients foot the bill for duplicated appointments and higher costs. Classic big government foot-dragging that hits the vulnerable hardest. Steele-John's right. This isn't about giving podiatrists new powers. They already have them. It's about closing a dumb gap so care is actually affordable. Labor had the chance to fix it right now and said no. Expect this fight to come back because common sense doesn't die quietly in the Senate.